and I've turned it off and I've still got the double thingy. Share my chat. That like it's not my chat. Okay, we're going to make a start while we wait for the slide pack to be made available, and at the appropriate juncture, comms will come in and save the day by getting the presentation up and running. So I'd like to open by acknowledging the traditional owners and custodians of the land on which we meet, the Whadjuk people of the proud Noongar Nation, and paying my respects to elders past, present and emerging. It's such a privilege to be standing on Noongar country, as always, and on our first day of autumn in our traditional 4 seasons. It is nice to be in Western Australia, even as the borders open and we start to see change with COVID. So thank you everyone for coming. We've got about 150 people online. We'll do staff forum update from, thanks Sasha, 2 to 3, and then from 3 to 3:30 we'll run the PPE presentation again for anyone who wasn't here last fortnight, and you'll be able to use the QR code to record your attendance, and that will mean that you have achieved your compliance with the PPE requirement. So just waiting for that to move into slideshow. Beautiful, thanks Sasha. So for anyone that doesn't know me, I'm Janet Zagari. I'm the Exec Director for Charlie's in Osborne Park. It's lovely to see you all here today. Can we go to the next slide, please, Sasha? I can't get control of the presentation. Thank you. And next slide, please. Next slide, please. So I wanted to talk to you all about this slide. So this is Bajan Singh, who many of you will know. He's a really familiar sight around Charlie's, and he's our head of department for Pulm Phys and sleep medicine. And Bajan is a devout Sikh, and he let us use his picture and his comments so that everyone could understand the lengths that people are going to in order to keep our staff and our patients safe. So as you know, facial hair is an impediment to achieving a safe fit. And so if you have facial hair, it is only possible in very limited circumstances to achieve a safe fit. Religious reasons are one of the exemptions to being required to be clean shaven, but if you can't achieve a safe fit, then you're not able to enter red zones and care for COVID patients. So Bajan took the very important and courageous decision to remove his facial hair to allow him to provide safe care for our patients and to keep himself and his colleagues safe. And what he said, and these are his words, is that this practice in the Sikh faith is a symbolic one. It's an important practice, but at the end of the day, it is a symbol, and the safety of our fellow human beings must come first. Symbols can be restored once we are on the other side of the pandemic. And Bajan was willing to share his story and his comments in order to say to everybody that actually this is really important. Fit testing is absolutely critical to reducing the spread of COVID amongst our healthcare workforce, and to encourage everybody to take a leaf out of his book and go clean shaven for the duration. Thanks, Sasha. Next slide, please. So the hot topic for today is visitors. As you know, we've moved into the SAR State Alert response red. And what does it mean in terms of visitors? It means a significant reduction. Can we go back to the last slide, please? We're just going to stay on the visitor slide. Thank you. It means a significant reduction in the numbers of visitors that are allowed to come into the hospital. We had over 2,000 cases yesterday in the 24 hours and heading up to 2,500 cases. So we're really starting to move into a high caseload environment. What that means is that the circulating levels of COVID in the community and local transmission of cases are quite high. And as you know, the borders are now open without a quarantine requirement. So we will also see a component of virus coming in from across the border. So as a consequence, what's really important is that we move into a principle of protecting those that are vulnerable. So if you look at the various phases that we've been in during the pandemic response, actually when the borders were all completely closed and we had lockdowns, that was a protect everybody setting. Whilst we got vaccination levels up and hospital preparedness, now that we're in that phase of moving towards being in a living with COVID environment, we actually need to focus particularly on protecting the vulnerable. As we know, people in our hospitals are absolutely within that vulnerable group, and there are specific wards where our patients and community are more vulnerable. So we focus on RAT testing visitors to intensive care unit, to G63 as the transplant ward, and to patients on G54 in haematology oncology, because that's where our particular clusters of more vulnerable people are. With the higher circulating levels in the community, it's important that we reduce the numbers of people coming onto site, to reduce the amount of virus that's coming onto site, to protect both our health workforce, but more importantly, our patients. So the policy is really quite clear. We're circulating some guidelines for patients that will go out on the meal trays tomorrow. We've had an unfortunate hiccup on the Charlie's site in that flyers went out on meal trays today, which have the rules that applied until yesterday. So the nurses have gone around on those wards and withdrawn them, but there may be some patients who've received the wrong advice. All the websites are being updated. So there's a concept called an essential visitor, and it really looks at those categories of visitors who are allowed to come into the hospital because they care for, I'm just going to mute whoever's got their microphone on, they either care for patients with a disability, and whether that be a physical disability or a mental health disability, or they are parents of a child or an essential visitor support person for labour, or an end-of-life support person. In addition to essential visitors, there is one criteria around some discretion, and that is for compassionate visitors at end of life. And so there's an exemption process to go through. So we should be telling our visitors that they need to have an approval before they leave home, so that they don't arrive at the doors of the hospital and then queue to be told that actually they won't be allowed to come into the hospital. So all the information will be up on the hub. The more staff talk to patients about it, and the way we look at other ways of being able to provide for their psychosocial support, such as the use of FaceTime or video calling or other mechanisms, and supporting that psychosocial wellbeing, understanding and acknowledging what a difficult time it is for our patients, for their families, but also for our staff who are dealing with the consequences of that at a ward level, and who feel very strongly in advocating for their patients and the emotional impact it has of not being able to bring visitors in. So we're very conscious of that, and what we're doing is balancing those psychosocial needs with the health and safety risk for staff and patients. If you've got any questions about visitors, you can either send them through to the Ask Janet mailbox or have a talk to the ward manager or CNS in the area where you work, because they'll have more information for you. We're going to move to the next slide, Sasha, and I'm going to hand over to Dr. Ajitha Nair, who's our Director of Clinical Services.
Thanks, Janet. As you very rightly mentioned, WHO Health System has now moved into the red alert phase of the system level alert and response framework as of this week. By 5 p.m. today, all hospitals in the state are expected to have implemented the changes in the red alert phase of the system alert response. What this means is that there is now widespread transmission of COVID in the community, and what we are doing in this phase is that we are moving up to additional measures and additional steps to protect our most vulnerable section of people in the community, and that is our people in hospitals, our patients in hospitals. We are also making sure that we as a hospital or hospitals have the capacity to look after the number of patients with COVID and without COVID coming to our hospitals over the next few weeks as cases rise in the community. And this is a reason for some of the changes in the SAR, and the key changes are the use of N95s or P2s, which are a higher level of personal protective equipment, a higher level of masks, offering better protection. We have amended visiting guidelines, as Janet mentioned, and the intent is to reduce the number of people that we have on site to be able to maintain distances and look after our patients, and also to reduce the risk of exposing our patients to COVID that is there in the community. The other big change in this phase is the testing guidelines and requirements, and the intent of those changes are to ensure that we are able to diagnose COVID really quickly, particularly in patients who are in hospitals, and make clinical decisions quickly to provide the best treatment and care to patients with COVID. Going to move on to the next slide, which is a little bit of probably a repetition around masks and the why of masks and the importance of using masks, and probably some scientific basis to it for those of us who are interested in the literature and evidence around it. The first two dot points are around N95s, and I will let our occupational health and safety team talk through one of the types of masks that have ceased in production, so we'll talk about it a little later. But I think what I really wanted to highlight here is the reason for using masks, and the reason for using masks appropriately. There are studies out there which have shown that it significantly reduces the risk of transmitting COVID or giving COVID to someone that you have been in contact with or in close contact with. And same with eye protection. And in fact, there are studies out there which show that there is significant reduction in transmission when we use eye protection. None of this is easy, and we are not used to it, but it is really important that we are aware of the importance of this in reducing transmission, not only to our patients, but also to our colleagues whilst we are at work. The reality is that COVID is in the community, and there is likelihood of transmission when we are out in the community, just as when we are in the hospital. I think it is important to make sure that we do whatever we can to make sure that we all don't get it at the same time, which will mean that we don't, as a system, we won't have the ability to look after our unwell patients who will need to be in hospitals over the next few weeks. Next slide. Again, masks and the why of masks, and that slide very beautifully demonstrates how masks are protective and why we have moved to N95s or P2s at this stage of the pandemic, because it offers a very high level of protection, certainly compared to not wearing masks, but also compared to surgical masks or cloth masks. Thanks, Sasha. Next one. Probably the slide before Sasha, just a reminder to all of us to look after ourselves too. It's not normal for us to be walking around in PPE all day. So really important to make sure that we moisturize our face, use masks that fit appropriately, and make sure that we take breaks appropriately and within recommended time frames. Really important to use the appropriately fit tested masks and make sure that we are protecting ourselves and our population. And similarly, taking off of PPE, including masks, is just as important as appropriately wearing them, because if we don't take it off appropriately, the risk of spreading the viral particles in the air and transmitting the infection to people around is really real and significant. I didn't know about the second dot point on that after mask use, which talks about do not cut off the ear loops. That is a recommendation, and I know that a number of us do that to protect the environment and make sure that birds don't get trapped in masks. However, that increases the risk of viral particles being spread in the air, so it's not a recommended action at this stage. Obviously, if you have issues, concerns, and problems with using the masks, please speak to your line manager, and we will make sure that you get the appropriate guidance and support through our occupational health and safety team. I am going to hand back to Janet to talk about breaks and safe breaks.
Thanks, Ajitha. I will just reassure you all that I am alone in my office with the door closed, and that is why my mask has been removed. So I wanted to talk about breaks, and Sasha, if you don't mind going to the next slide for me, please. Thank you. So what we've seen is that one of the ways in which people become close contacts, particularly in the workplace, has been around tea breaks and shared office spaces. So we wanted to get some practical tips, because we know that there aren't enough offices for everybody to have one to themselves, and we know that the tea rooms are not large spaces. And so what do you do to be able to minimise the risk of becoming a close contact and then needing to be furloughed, or actually getting COVID from an exposure from colleagues at work? Because the majority of furloughs that we've seen have either been from in the community or actually from between colleagues where there's been a community exposure and then they've become a close contact in the workplace rather than in dealing with patients. So remember that your risk of contracting COVID relates to the amount of infection density and the time that you're exposed. So how much viral load is in the air, in the room, and for how long that you're exposed to it. So how much viral load is in the air within the tea room is about how long people have been breathing out with a mask off when they have COVID in that enclosed space. And it's that combination of that and how long your own mask is off. So being in a tea room together, absolutely people need to have breaks. But if you're not eating or drinking, then having your mask back on. Eye protection's been shown to be one of the really clear reducers of transmission in the eastern states. And it's about what are the particular procedures that increase the risk. So unfortunately, we don't have bubble heads for everybody, although I do rather like the picture. But it is about looking out for each other. And when you're at a tea break, remembering that your risk is actually still the same, or in fact higher, because you're out of a mask than it is out and about while you're doing your clinical duties. So David Spears and Helen Cadwallader have kindly put together some points, and we will share these. And I'm just going to read from them while we're online. So number one, it is all about the masks. So if a positive case is not wearing a mask, and there's lots of other people also not wearing masks in shared offices, for 2 hours, all of them will be close contacts. If your mask is sitting below your chin or under your nose, or in one case that I saw, not on one of our staff, I hasten to add, on your elbow, it's not offering you any protection. If it's hanging off your ear or it's not in place properly, it's not a mask. So it is absolutely all about the masks. So if you are in a shared office space, actually have a rule that only one of you has your mask off at any one time. So you want to be able to have a cup of coffee, absolutely. But it's that conversation to say, I'm taking my mask off now while I have my coffee. So everyone else in the office is aware, keeps their mask on, and then at the end of it you say, I'm putting my mask back on, and so somebody else can have their mask off to drink their coffee, have their water. Should be encouraging water, not coffee, but hey ho. That really clear conversation in those shared office spaces. Number 2, that soldiering on just takes out more soldiers. So unwell hospital staff spread infections to other staff and patients much more than patients do, because that's where you're more likely to have your guard down and not be wearing your PPE. So if you are sick, if you have symptoms, if you're unsure, please stay home and get tested. The ABC of hygiene, always be clean. So it is about good hygiene. Your alcohol gel, if you haven't got it in your areas or it's run out, please be sure to let your manager know so that we can get it replaced. Wiping down surfaces, all of those small things. So in shared office spaces, wiping your keyboard at the end of the day, using your hand gel. I particularly like point number 4, and this is going up on my wall. A problem shared is not a problem halved. So limit the number of people in the tea room or the office at any one time as much as possible. Staggering of breaks. Thinking about going outside for your break. We're looking at some additional gazebos in the ground so that there's shade. We know it takes time to walk from the ward down and out to get to break areas when they're outside. Absolutely understood. There's some latitude in that, you know, if you need 5 minutes longer for a break to allow that, all of those things. Use your 2 square metre rule to figure out how many people should be in the tea room at any one time, and removing chairs so that there's not too many people in there. Use your 1.5 metre rule, and remember that that's really quite a long distance, or it is if you've got short arms like me, and space your furniture apart. And limit the number of visitors coming into your office, so essential staff only, in the same way that we're limiting visitors into clinical areas. Number 5, fresh air is good for everyone, so do think about going outside while the weather's good. And cleanliness is next to godliness, so wipe down your high touch surfaces. If you haven't got access to your alcohol wipes, get the team to order them for you. Washing your hands after you take your mask off, not putting your dirty mask down on the table or on your desk, having somewhere to put it, or straight in the bin with a clean one ready to go on. So all of the simple things really do make a big difference. Sasha, if you can go back to the main presentation, please, that would be great. Yes, we do seem to have lost the visual, I think because we were looking at the PPE pack, but if we can get the original one back up, that would be fabulous. Thank you. And then we can go to the next slide, which will let me hand over to Kim McLean, who's our Director for Work Health and Safety, or OSH, as most of us will know it. And Kim's going to talk about rats and what to do when.
Fabulous. Thanks very much, and hi everybody. I just want to actually first just touch point on fit testing. So thank you, Janet, for really highlighting the importance of fit testing. A reminder for everybody is certainly best practice when we're in the red criteria, so make sure you've had your fit testing conducted. If there's anyone who hasn't, there are spaces available in the 8th floor catering room. That's the room just past the Josky room. Make sure you get fit tested. There's also availability. You need to book in, but there we have another machine here at R Block. So first protocol is all the links are in the globals. Make sure you book in and come and get fit tested if you haven't already been. I also want to talk, just before I hand over to Andrew, who's next to me, who will be talking about the rat testing and PCR and contact details. There is a new form that's being developed, and there'll be a global out today. So the form, and there's a new process. So when anyone comes back with a positive COVID result, or they're a close contact, or they have a household contact, or they're on carer's leave due to COVID, the new form is a way to log that and notify us. So you can be at home, it'll be on the intranet as well as the internet. So you need to fill in a form and, of course, advise your manager. So there will be a global out later today advising of the new process. There'll be some really easy user-friendly flow charts and posters available as well. So we are on the journey to making it user-friendly for all of the staff and an easy process. It's hopefully coming today. Oh, and I think we just lost the slides again. There we go. All right, I'm going to hand over to Andrea Carlin. Andrea Carlin is our lead health and safety nurse for staff safety.
Thanks, Kim. So first, as Aditha mentioned, I'll just run through respirator options that are currently available. And now that we've gone into red, clinical areas, you must be in an N95 respirator and eye protection. If you have not been fit tested and this is affecting you, could you please wear an 1870 3M Aura respirator, which is the one with the red bands, or a Trident, which looks like that one. Okay, you must do a fit check prior, and this will be explained in the PPE training after at 3 o'clock. So the fit checking process is really important, where you're checking for air leaks. If you haven't been fit tested, you can wear either of those respirators as long as you're happy with your fit check. You need to book in for a fit test as soon as possible. So contact the fit testing team either by phone or by email to get squeezed through so that you can find your correct fitting respirator. These two ones that I just showed are the ones that fit the vast majority. There are some respirators that are in short supply or getting phased out. So if the 9320, which looks similar to the Aura, the 1870, but it has blue straps, if that is your only option after your fit test, please book back in. That one is on the way out because the 1870 is replacing it. So you'll need to find another option. Likewise, if you only fit to the small respirator options of the 1860, which is the hard cup style, or the Pro Shield or the Halyard, could you please, if you have the 1870 as your already fit tested option, use that one, or a medium. But if you only have a small option available to you, book back in for a fit test, because likelihood is you'll fit to the Trident. Okay, that's from everyone's gone gangbusters in ordering stock, and HSS weren't quite prepared for an influx of small orders. So if you have a medium option available, please use that. And if you don't, book back in for a fit test. So some common questions regarding rats. Rats is a ever-evolving space, so there will be communication to staff around rats, but I'll answer what I can at the moment, knowing that advice will be updated through comms. So do I need to have a rat and when? If you are feeling unwell or symptomatic, yes, please attend a rat and notify your manager or OSH with the result if it is positive. There are workspaces where you can conduct voluntary asymptomatic rats. So if you're unsure if that's you or not, please talk to your manager. The other reason why you might be doing a rat is if you've been identified as a close contact following a high risk exposure to a COVID-19 case. If that is you, then you will be given an email from OSH, or in the very unlikely chance, Public Health, outlining when you need to do your rat test and what you need to do if it does come back to a positive result. This is where the form that Kim spoke about will come into play as well, and it will make it much more easy to follow and understand. If you, and I mentioned just briefly before, reporting your result, we need to know about a positive rat. So that must be logged on the WA Health site, and your manager needs to be updated as well. Again, there'll be that form to follow that process. What do I do if I feel unwell, a rat or a PCR? So there's PCRs still available in COVID clinics. They're not inundated. So if that is your option, fabulous. If you opt for a rat and you have it available at home, you can do that as well. If you don't have any rats available to you, please attend for a PCR. And this is where that update information will come. What do I do if I'm a contact, and what number do I call? So public health have stepped away now from notifying close contacts in the community. So you may well get a phone call from a friend or family member saying that I'm positive and you're a close contact. You need to update your manager and they in turn will update us as well. Or you can come directly to OSH too. But you always need to keep your manager in the loop if you're going to be furloughed or required to isolate. And this is the form as well. So all roads will lead to this form. It'll be very streamlined and lead you to your next step of action. The number to call at the moment is the OSH nurse number for any questions. If you're not sure if you meet close contact criteria as well, which is very common. There's a lot of confusion going on out there. So just call the OSH nurses on 6457 2897 and I'll put it in the chat.
And it'll be in the global.
And in the global as well. And what do I do if I'm RAT positive? You must isolate. Stay in isolation, let your manager know. There'll be the form when it's out and about. And also you need to log your positive RAT with WA Health. That's it.
Thanks, Andrea and Kim. That OSH number, is that valid 6 a.m. till 8 p.m? Yeah. And
Yes,
after those hours, ring through either to your to the after hours managers or to exec on call, so that we know that you're not going to be at work the next day, and we can be certain that we've got arrangements in place for covering the workplace. Okay, if we can just go to the next slide, please. So I would like to introduce Vanessa Hart from WhatsApp just to talk briefly about staff wellness and wellbeing in light of the heightened anxiety around COVID and the increasing pandemic activity. Thanks, Vanessa.
Thanks, Janet, and good afternoon, everyone. I'm Vanessa. I'm one of the members from the WhatsApp group. So WhatsApp have been busy recently trying to work out how we can adapt to the ongoing changes and the restrictions in terms of identifying ways and what we can offer. And a lot of ideas that we've come up with have been, in most cases, online. So currently we are working with the North Metropolitan Health Service Wellbeing Manager to make available for staff a series of online workshops. And this is going to be held in association with an external organisation called the Holistic Services Group. And it will be run over the coming months and the schedule will be available on the WhatsApp hub page. The topics are going to cover a wide range of subjects, including how to manage your stress and anxiety during a pandemic, how to survive and even possibly thrive during the pandemic, resilience and growth mindset, and then there'll be some other items, including laughing yoga and nutrition. So they're just to name a few. So do watch out for those. During the World Wellbeing Week, which is the 20th to the 24th of June, we're also going to be running those workshops on a daily session, and that schedule will also be made available. So we encourage all staff to hop onto the WhatsApp Wellbeing Hub page and keep an eye out for those schedules and get involved. There's some great information to be shared there. The other thing that's been going on is WhatsApp has recently created a new staff wellbeing WhatsApp channel on MS Teams. Some of you may have already noticed it there when you've logged on. All the staff across both sites have already been automatically added to that channel, and you're welcome to go through, encouraged to go through and have a look at some of the resources that are already available. There's some video links to seminars last year, there's posters, there's a wellbeing calendar for ideas. But that will continue to be updated on an ongoing basis with more resources being added very, very shortly. So jump on board and have a look at that one. Some of you may remember last year, WhatsApp did launch an initiative called the Wellness on Demand platform, and it's currently still available. It's a wonderful free resource to all staff. And basically, it is an online video library, so staff can register for free and jump on, and there's videos of different durations. Some are shorter, some are longer. They cover a whole variety of different types of exercises, from strengthening, stretching, yoga. There are mindfulness activities. There's even short clips on nutrition and how to manage personal finances. And so if you're interested in logging on to Wellness on Demand, there's a couple of different ways you can access that resource. If you go to the hub page, there's a link there that will take you through to to the subscription page where you sign up. Some of you may have even seen the posters around both the hospital sites at Charlie's and at Osborne Park with the QR code, so you can actually scan and jump on board that way. And of course, it will also be available on the MS Teams channel as well. So a wonderful resource, and possibly a great idea if you're sitting out in the garden at lunchtime. You might just want to pop on and look at a quick 5-minute video or a 15-minute video. So do try that. It's a wonderful resource. In April, we're very, very excited. We're actually going to open up the orders again for the Fun Top Friday scrubs and polo shirts. So if you're looking to update your work wardrobe, please do order some. We have the same designs available as in previous years with the beautiful Aboriginal artwork and also the diversity scrubs and polos. And it's probably a really good reminder just to let staff know that $5 from the sale of each of those tops is actually donated to the Aboriginal Health and Wellbeing Committee, and that money is used by that committee towards supporting our Aboriginal inpatients in a variety of different ways. So it's a wonderful initiative. So keep your eye open for that. Global emails will go out coming soon. But again, those links everything's available on the WhatsApp hub page. And Easter's just around the corner, so do keep an eye open for some fun activities, something a bit lighter in the lead up to Easter. One of the activities will include a mindfulness colouring in competition, and I believe that there will be some yummy prizes available for the best colouring in. And that's pretty much sums up most of the projects that the group have going at the moment. We are also having discussions just around, we know over the past few years, the community has been very generous in making donations towards health staff. So we're just having discussions as to how do we manage those donations to ensure that we do comply with integrity and ethics, but also when the donations come in, how are they fairly distributed across the workplace? So a little bit of work going on in the background there. But that pretty much sums up some of the main projects that the group is working on. I just do want to take a quick moment just to say thank you to all the WhatsApp team members. All those members do actually undertake these additional duties on a voluntary basis, and they are on top of their current workloads. But a very special mention to Hannah Flynn, our chair, and Stacey Dips. They're incredible hard workers. They're the driving force of the group. Without them, we wouldn't have a lot of the steam behind getting some of these projects off the ground. So thank you very much to those two lovely ladies and the support of Lucy Gent. And if staff have any ideas on what they would like to see the WhatsApp deliver for you in terms of wellbeing in the workplace, we'd love to hear your thoughts. Please do email us at whatsapp@health.wa.gov.au, and those contact details are also on the hub page, or you can contact us also through the MS Teams channel. So thank you very much. Have a great afternoon.
Thanks, Vanessa. That was wonderful. It's never been more critical than ever to really look after our wellbeing and one another. And I would like to echo Vanessa's thanks, but go out more broadly than just the wonderful WhatsApp leadership team to actually all of our staff who are continuing to provide excellent care despite staff shortages with furloughing, stressors at home, particularly those with young children, with the number of schools that have been impacted and all the close contacts. What we're hearing from many of our staff who are furloughed is that they'd really like to be in the workplace and with their colleagues. So my thanks to each and every one of you, and can we please continue to be a bit kind to one another. Now we've just got a few good news slides that we want to share with you before we go into the PPE training session, and we'll have an opportunity for questions in between times. If you've got questions, if you can pop them into the chat and we will answer them during the Q&A time. Sasha, if you can press play on this. This is a report that appeared on Channel 9 earlier this week and really highlights the amazing work that's being done by our staff across the group. I'm sure we will have sound in just a moment.
Sorry, Janet, working on it.
No worries, Sasha. While you work on that, we might just do a quick talk about the slides that will follow this, so you can enjoy the visual of Fraser and the ward if you've ever wondered what happens up on 71. Once we've got the audio working and you've been able to watch the video, we're just going to talk about the new initiative called the Power of Us, which is the North Metro Health Service Climate and Sustainability Program, which kicked off yesterday and is really a focus on what we can do across all of North Metro to reduce our climate footprint and actually reduce our environmental impact. As we know, hospitals and health services are huge consumers of power, water, plastics, all sorts of things, and the opportunity is for us to become more sustainable in our practices so that we can do better for our environment. So you'll start to see loads of posters around the organisation, and the great thing about the posters is they've actually been printed on recycled material and are recyclable and washable for infection control purposes, so are a great example in and of themselves of sustainability. So there's lots of activities all through March, and eventually we will put the calendar up for you. What we'll do, we might give up on this one, Sasha. We'll circulate the link out to everybody in the global. If you didn't get to see it on the news, if you can take a moment to watch it. It was a great way to show all of Perth what great staff we have and the work that's been done to make sure that we're COVID ready. And if you've wondered what it's like up on 71 now that they're the COVID ward and you can't go wandering through, this is a great way to find out. So we might move on to the next slide if you don't mind, Sasha. And just a reminder, I think thanks to Osh for the information on what to do if you're not fit tested and which mask to wear, but remembering that you must be fit tested to go into a COVID patient area. So you can't go into a red zone or care for a COVID patient unless you've been fit tested and have the appropriate mask. But you can use a fit checked mask to be able to be in general ward areas until your fit testing's done, but you cannot look after a COVID patient in a mask that is not fit tested to you. Okay, so this is the Power of Us program. Next slide, please, Sasha. Thank you. And here's the calendar for March. So it's all up on the hub. You'll be able to find it. Lots of activities all over North Metro. There's the opportunity to make a personal pledge or for you to make a pledge as a team. So you might, as a leadership team for a ward area, or we as an executive group might make a pledge to turn off the lights each night, to recycle, all sorts of things. And what we're keen to do is capture ideas from staff about the other things that we should be doing. So King Eddie's have signed up for the EPIC program, which is looking at really reducing the plastics used in hospitals and how they're recycled. And so the opportunity is across North Metro to learn from one another, to get new ideas, and to harness the great passion that staff have for a more environmentally sustainable organisation. So send us your ideas, make your pledge, and let's see what we can do. Okay, so Siobhan's asked, while current visitor restrictions are in place, will there be a return to something like the seasonal parking for Charlie's staff who do not currently have parking so they can avoid public transport? So we're working at the moment, Siobhan, on how and when we might be able to increase parking for staff. Certainly the reasons that we haven't been able to in recent weeks have been the demand during those peak hours with visitors. So it's being monitored actively by the QE2 Trust for the Charlie's campus, and then for other campuses around North Metro by the local organisations to see what the daily volumes are to be able to release parking for staff for that purpose. So to reduce staff needing to rely on public transport, and also because I'm sure saw the announcement by the Premier recently that said that at some point during pandemic, we will get to a point where we bring back staff who've been furloughed whilst they're negative with a daily RAT test and in full PPE. And one of the rules around that is when they're not at work, they will have to isolate and they're not allowed to travel on public transport and so on. So we will need to have access to parking in those sorts of circumstances. And so we are working on how we can access additional parking depending on how much visitor volume we're seeing on site. Have we got any other questions? If we're in a shared office in a non-clinical area, do we need to wear N95 masks? No. So still surgical masks in those non-clinical areas. And you can come into the hospital and transit through hospital in the surgical masks, remembering that if you are entering or transiting through an area where there's patients, you need to add your goggles so you can goggle on with your surgical mask, but surgical masks are still acceptable in a non-clinical area. To be clear though, a clinical area will be anywhere where patients are seen. So specifically, we know that in some of the office areas, thanks Tanya, goggles, in some of the office areas, there may be patients being seen, particularly in some of the doctors' offices. And so if there are patients seen in the area where you are, that counts as a clinical area. If you're the clerk down in the E-block admissions area where patients come through on their way up to a ward, that counts as a clinical area because you're seeing patients there. So it's not that you're in an office space, therefore it's non-clinical. If you are reception, front desk, so that entire office becomes clinical because there's an interface with patients. So if you're in an area where you deal with patients, you're in a clinical area and you need to be in an N95 and goggles or face shield. Any other questions? If not, we will let, right. As a doctor in a clinical area dealing with patients, should I be provided with hospital scrubs? It's a good question, Eva. So scrubs are a really important issue. What we're finding is that the perioperative areas are running short of scrubs because people are accessing theatres to get scrubs for non-procedural areas. So we had what could have been an extraordinarily embarrassing situation last week where there were no pants available for our theatre staff, including disposables. So whilst some scrabbling was done to get hold of them, it's really important that the procedural scrubs are located and left for the procedural areas. You can wear scrubs, equally you can wear your own clothes. Where your scrubs are provided by the hospital, we do encourage you to use the hospital laundering process. We have worked to have scrubs available to doctors who could purchase their own over the past 12 months. There are not additional scrubs available at this time to hand out to staff who don't currently have uniforms. So we are working to secure additional stocks of disposable scrubs. But at this stage, if you don't currently have scrubs and you are wanting to move into scrubs and you're not a discipline that has a uniform, you need to purchase your own, and we've got some contacts for that may help. The other thing we're looking at doing is there's a number of community groups that have previously provided scrubs for people that voluntarily want to wear them, like in Spotlight ran a campaign in the eastern states, so we're reaching out to them as well. Adam, are we following the advice from the CHO for critical health worker close contact rules? No. So the only way that staff who are close contacts can return to work is if they have an approval by their employer, and they will be contacted by the employer. That doesn't apply as a standard immediately. And so whilst it is now an option that's available to hospitals, we have to be certain that the threshold is met in which the risk associated with bringing contact staff back to work outweighs is less than the benefit of. So we need to be sure that the benefit is greater than any associated risk. So there's some quite specific criteria that need to be met before we can return asymptomatic staff who are close contacts, and that is an executive decision and staff will be contacted. So no staff should be at work who are close contacts without specific and express approval from the executive. And Mandy and Ajitha are right. For those of you that can't see the chat, or particularly where there's a number of you in the room, please don't take the scrubs home. If you've got them in your lockers, if you've got them at home, absolutely no questions asked for the procedural scrubs, bring them back for us. And we are looking at ways to get more into circulation and looking at ways to increase access for those who don't currently have provided uniforms to other options. But we do need the theatre scrubs back because nobody wants the theatre staff with no pants. Okay. Thank you very much. If there's nothing else, and thank you to everybody who's presented here today. Always happy to have questions come through to the Ask Janet mailbox. If there's something you want to know you didn't want to ask today, or you want us to come and chat in your area in particular, we can do all of those sorts of things. Private companies such as Linear and Harry Perkins having to screen patients. Sarah, is that the patients coming into their areas? Because certainly they've had screening processes in place, in fact, probably more stringent than WA Health, to be honest, in line with what the private hospitals are doing. So they definitely have screening processes in place. Yep, good point, Adam. And yes, it's probably not an immediate thing, and we like queries. We will move on getting them made automatic. The other thing is I had a lovely email yesterday from one of our staff saying that the new exit doors where you come out at night is quite dark. So what we're doing is getting some additional lighting installed. I think that was an unforeseen consequence, so that if you're coming out in the middle of the night from an evening shift, you're not stepping out into the dark before you get onto the footpath. So anything else that you notice around those new entrances, if you can let us know, that would be great. And Adam, the other thing is looking at having PPE available as people come in those doors and manning more doors over time as staffing's ready. Not at the moment, Helen, unless there's a challenge particularly around Crawford Lodge, and happy for you to send me an email if there is an issue. Thank you. All right. And Kimberly, thanks, Meg, good news. And Jeremy, I assume, is with you. We'll hand over to you now for the PPE training. If you've done your PPE training, you don't have to stay, although I thoroughly recommend an update because I watch mine every time I'm going down to the rat station to make sure I put everything on in the right order before I start ratting people. But if you haven't done it, please do this. Make sure you scan your QR code so we can get you registered. Remember, this is mandatory for all staff, and a really great presentation, 30 minutes. Thanks, everybody. Thanks, Anne.
Thank you. Thanks, Janet.